Let's start with this vote that's happening in your chamber later today. Correct me if I'm wrong. I'm assuming that you're going to vote against it based off of the procedural vote we saw yesterday. Let me know on that. And if so, do you have any appetite for an extension down the road if we do get something different from the upper chamber, maybe a shorter extension with some structural changes?
What we have an appetite for is to lower the cost of health care for all Americans. That's 347 million Americans. Unfortunately, what is on the floor today only addresses 7% of the population. And what's quite unfortunate, that 7% is part of the Obamacare exchanges that is just littered with so much waste, fraud, and abuse. The Government Accountability Office just came out with a report a couple weeks ago that cited 59,000 dead people the insurance companies were being subsidized for. One Social Security number was tied to 125 plus different policies. We need to make sure we fix the system, get out the waste, fraud, and abuse. We saw what's going on in Minnesota with fraud. We need to do that, and just extending current status quo is unacceptable to the taxpayers.
Well, Mr. Chairman, it's good to see you and welcome back. I wonder in that case if you might warm up to the idea of what's in this Senate bill. The Bernie Moreno bill would cap eligibility at 700% of the federal poverty level and require a minimum premium payment. Is that closer to what you're looking for?
It's definitely a step in the right direction, but what we have to understand is as of January 1st of this year, those extended COVID-era subsidies expired. The Democrats created them in the American Rescue Plan, and they made them temporary. They extended them in the Inflation Reduction Act, and they're the ones who set the date for December 31st of this year. When you look at that, in those subsidies, they allowed an unlimited amount of income to be subsidized. So like a husband and wife making $600,000 a year is subsidized. It now reverts to 400% of federal poverty level. So anyone below 400% federal poverty level will have substantial subsidies.
Is this vote happening today a reflection on Republican leadership in your chamber? Because, Congressman, the only reason why it's happening is because some of your colleagues crossed the aisle to force that discharge petition.
This vote's happening because Republicans are standing for all Americans to make sure that we lower health care costs for all Americans. All that the Democrats have been holding out for is just 7% of the population, 24 million people that's on the exchanges. But let's talk about those 24 million people on the exchanges. Last year alone, 12 million people on those exchanges didn't file one medical claim, not even a prescription. You cannot tell me those people did not have health care expenses. They just simply didn't know that they were automatically enrolled. But guess what? Those insurance companies, they were all being subsidized.
Well, last time we had you here, Mr. Chairman, we talked about the possibility of a government shutdown, or on the other side of that coin, maybe an actual budget by the end of this month. I know at one point you were in favor of just clearing the decks, as you told us, and doing a year-long CR. That was ahead of what became the longest government shutdown in American history. Now that we're seeing minibuses start to move, I'm wondering where your level of optimism lies and whether these votes have something to do with it. If the health care vote in the House doesn't pass the Senate and vice versa, are we at greater risk of shutting down?
We have 3 of the 12 appropriations bills signed into law. We have 9 more to do. 3 more will be attempted this week. I believe that those will pass, go to the Senate, and get the job done. We're not. I hope that all of my colleagues have learned that a government shutdown is not the answer, and that we're going to come together. And it appears so far from every indicator that I've seen that no one wants a government shutdown. They want to work together. They want to fund government. And I think that we'll get the job done.
Well, sticking with the budget, President Trump is calling for a record $1.5 trillion defense budget. In a post yesterday, he wants to see this massive $500 billion increase. Are Republicans ready to get behind that?
So I don't know exactly what you're talking about. It's not something that I have seen. But what Republicans are focused on is getting our fiscal house in order. I can tell you, and so is the president, if you just look at last year, Last year alone, out of 12 months, 3 of the 12 months, for the first time in decades, did we have more revenues coming into the country than we had expenditures. In the months of April, June, and September. That hadn't happened in decades, so that's a step in the right direction, but we need it for 12 months, not just 3.
Well, we'll show you the post, Congressman, yesterday, this coming from President Trump, saying in part, quote, after long and difficult negotiations with senators, congressmen, secretaries, and other political representatives, I have determined that for the good of our country, especially in these very troubled and dangerous times, our military budget for the year 2027 should not be $1 trillion, but rather $1.5 trillion. Does seeing this post now change any of what we just heard from you in terms of your answer and the viability for this?
One of the most important responsibilities of the federal government is national security, and that's making sure that our citizens are safe. And that is a huge focus of this administration. Unfortunately, the prior administration, they were out to lunch when it came to protecting the homeland. That's why, under President Trump's leadership, we have record lows in violent crime in the United States, actually the lowest in 5 years, and just all across the board, record lows. So the president is all about law and order. He's investing in law and order, and that should be a priority for Congress, and it's a priority of the American people.
No, we wanted to ask you about that because, my gosh, a $1.5 trillion budget would have to probably have to be managed by raising some revenues or cutting a significant amount of spending. But, Mr. Chairman, we've only got a couple minutes left, and I'd like to ask you about what appears to be a looming decision by the Supreme Court on tariffs. This could come tomorrow. We know it's a decision day. It might involve other decisions as well. But at some point, the court's going to have to rule in the near term on this. And I'm wondering if they do strike it down, as tariffs are the purview of the Congress, will there be legislation to back up the president to do what he's trying to do through legislative form? Has that bill been written?
There is no question that whatever the decision is from this upcoming Supreme Court are going to have huge consequences, and Congress will have to act appropriately. It's why that is the first and only time that I've ever sat before the oral arguments, and I did during that case a few months back. And I think it rests within just a couple different justices. Actually, 2 would be my guess, and I'm hopeful that they'll make the right decision. I believe the president has the authority to do what he's been doing clearly under IEPA, and let's see if the courts will decide on that. If the courts rule the other way, Congress will act appropriately.